Today in the United States, 42 families hear these words: your child has cancer.
Yeah, but here in the Bay Area, one little boy named Quincy got a miracle thanks to some pretty smart doctors whose guess paid off.
KPIX 5's Juliette Goodrich has tonight's original report.
Here at UCSF Benioff Children's Hospital, it took a team to out-hustle, out-hit, and never quit on a tiny kid named Quincy. At Oracle Park in San Francisco,
You're so fast.
this little giant's got game.
We're at the baseball game? Who are we going to watch play? We're going to watch Buster Posey?
His name is Quincy Lodge, and he just turned 3. His parents are thrilled to bring Quincy to his very first baseball game. You see, it's a miracle he's even alive.
You're a special little boy, you know that?
When Quincy was just a few months old, he was diagnosed with a rare, very aggressive type of blood cancer.
My reaction was, please don't take my baby.
It was a big shock, to say the least.
It's called juvenile myelomonocytic leukemia, or JMML for short.
JMML is a notoriously difficult cancer to treat.
UCSF's Dr. Mignon Lowe remembers the first time she met her little patient.
Quincy was a very sick young baby.
Quincy showed clinical signs: a rash on his face, elevated white blood cell counts, and a severely enlarged spleen.
His stomach was huge, like a football.
It was so enormous he couldn't even eat.
They decided to remove his spleen.
With JMML, the only hope for a cure is a stem cell transplant involving intense chemotherapy. But
We gave the chemotherapy and it didn't work.
that meant no stem cell transplant. For Quincy, time was running out.
We had exhausted all regular and conventional therapies.
He was dying for all intents and purposes. It was scary.
However, elsewhere at UCSF,
There were a few odd aspects of Quincy's presentation.
virtually all patients with JMML have a known genetic abnormality in their cancer cells, but not Quincy.
We could not find a mutation in his leukemia.
Dr. Elliot Stieglitz and his team took a deep dive into the baby's DNA. They used an advanced molecular test called the UCSF 500.
Where we read all the letters of DNA in 500 genes that commonly cause cancer.
Then an even more sophisticated test.
We also wanted to make sure that this was accurate.
And bam, home run.
To our surprise, we found that Quincy had a fusion between 2 different genes. These genes normally live on 2 separate chromosomes. But inside of Quincy's leukemia cells, these genes became fused together.
And this fusion was fueling Quincy's cancer.
They had never seen it in a JMML patient.
The good news, there's a treatment option for the fusion, a targeted therapy that blocks it. The bad news,
They've never used on an infant, and they asked us to trust them. And we did. It was a huge leap of faith.
the doctors made an educated guess at a dose. The pills were cut into tiny pieces. Then
All of a sudden, Quincy's white count started falling.
it was a grand slam.
It was a miracle.
Quincy's cancer started to melt away.
The cancer was undetectable.
But you'd never know that he had leukemia if you just met him.
The team's work is published in a prestigious medical journal.
This case really highlights the need to think outside of the box.
As they say, teamwork makes the dream work.
We hit the geographical jackpot by having UCSF in our backyard.
Quincy finally got his stem cell transplant, and he is in full remission. In San Francisco, Juliette Goodrich, KPIX 5.